Hello, this is a presentation for the ABLE 2022 meeting where this learning module will be presented. And our players are Dr. Ann O'Neill, Dr. Rebecca Krall, Rachel, and myself, Robin. And we hope you enjoy listening to this, and we look forward to any comments and suggestions that we can change before we teach it for other classes. So here we will start with Dr. Krall.
Hi everyone, my name is Becky Krall and I am a faculty member in the STEM Education Department in the College of Education. I'm looking forward to working with you and Dr. Cooper and Ann this semester. I will be helping with data collection and analysis.
So now we have the class homework and a pre-survey that we've given to a class and learned that really we didn't expect many of the students to know some of the topics that we were covering or much detail, but after this and after doing their homework, we had seen improvement in their understanding of the content. Basically, we wanted to make sure that the students understood about a neuron and how it electrically communicates to other cells via synaptic transmission, chemical synaptic transmission, and what explains the resting membrane potential by the different ion channels in the concentration gradients of different ions across the membrane. So we started off with an equilibrium potential by understanding the Nernst equation, and then the Goldman-Hodgkin-Katz equation, which then considers multiple ions and the permeability of those ions. And then we draw out an axon to explain the electrical excitability and electrical conduction of neurons, and we use two different types, generally the myelinated one and an unmyelinated one, to explain some differences, specifically because in MS, multiple sclerosis, there's a demyelination of neurons and how that can change electrical conduction. And as I mentioned, we go over synaptic transmission, chemical synaptic transmission. And in doing so, of working out the, say, an action potential shape, one will then go through different types of ion channels that are present, mostly the voltage-gated sodium channels and voltage-gated potassium channels, and at the nerve terminal, adding in a voltage-gated calcium channel. And then they will find out that there are different types of potassium channels as we go along in the exercise. We address the pharmacology related to various channels and how they work, and selectivity of some of these pharmacological compounds, particularly antagonist to the potassium channels, which we're focusing on because of the module focusing on multiple sclerosis and the use of 4-aminopyridine. Then we talk about the clinical appearance of the disease, multiple sclerosis, epidemiology. How do students look up some of this and have them maybe write a short paragraph or in bullet form information. Of course, this can be found on multiple pages, web pages, and relatively quickly online. And then maybe some details about multiple sclerosis and how it's not just the destruction of myelin, but also an immune response, and that it's really more complicated than we might initially think, and how the blood-brain barrier is disrupted. And then how histology can help in the diagnosis of multiple sclerosis and along with the inflammation, and how that diagnosis is made via magnetic resonance imaging and using what's referred to as the McDonald criteria of 2017. So they have some homework to do. This could be sent home for them, and then they could detail that out, and then you could go over it after they hand in their homework assignment, and then they can compare their own notes or make additions to their notes. Then we want to go over postulate how 4-AP may benefit MS patients and what's presented in the literature. Address this pathology of MS may complicate how these concepts in the literature of how 4-AP is working, and then address these concepts in the potential actions, with MS and some of the controversies presented in the literature about the actions of 4-AP in treating MS, or at least in relieving some of the symptoms. address what they can gather from this latest information in 4AP, and then maybe think back about does that really describe how that's working? Relate all this content to the theme of the case study that's presented. So they can go off in tangents pretty well on these different topics, but if it's all related back to this initial case, then I think it'll keep the students focused. From the readings and the knowledge, they could address, why only a subset of the people with MS are benefiting from the treatments of 4AP and some of the side effects of 4AP. And this, maybe they'll have some ideas about what the next steps might be of how 4AP is working, or maybe new medications that could be applied to multiple sclerosis. So here's the case study by Dr. Ann O'Neill, physical therapist.
Hi, I just wanted to introduce myself. I'm Ann O'Neill. I'm a physical therapist that works primarily with the neuropopulation. We will go over the case study a little bit later in this talk. So let's talk a little bit more about this case study. You have your classmate Jane, where she's first demonstrating symptoms of clumsiness, lower extremity weakness, double vision, overall fatigue. You don't see her until the next semester, where she's starting to walk a lot more slowly, seems a little bit more cautious walking pattern, has trouble going up and down the stairs, reporting these pins and needles sensation in her legs, and just overall fatigue. Maybe she had gotten a little bit better between the 2 semesters, or maybe things are just progressively getting worse. So she's working with her doctor to figure out, what is going on here.
First, we need to go over the basics of neurophysiology, as we mentioned. And this could depend on your class, how much time you need to spend going over this. It's an advanced class. This might be a review for them. If it's a beginning class and you're using this as a module to know why these concepts are important to learn, then you might have to spend more time than what I'm going to do by going over it right now. But I think it's good that the students learn some of the history, in the sense that a lot of our understanding comes from invertebrates about how neurons work and even synaptic transmission. Much of the understanding came from this wonderful animal, the squid, because they could take out a full axon out of the squid right here. They could take these axons out and look at even presynaptic terminals and postsynaptic terminals. They could look at conduction velocity along the skin, along the axon. And not only that, these axons are large enough in diameter, like the size of your pinky, they could actually cut this out, squeeze out the cytoplasm, tie off one end, put a wire inside of it, and then change the solution as they like for the inside, and then take that whole preparation, like put it into a culture dish or a petri dish with, say, known saline outside. Initially, they just use seawater, and then understand the basic principles of electrical conduction down the axon. So this is really the beginning of understanding electrical conduction and even synaptic transmission in using the squid axon. And so to this day, it is one of the model preparations that's used. Okay, here you can see the dye-injected presynaptic cell and the dye-injected postsynaptic cell here, and the electrical events that people could actually measure. They could put electrodes even in here, an intracellular electrode here, an intracellular electrode in the postsynaptic. You can stimulate the pre and record in the post, and address many of the properties of synaptic transmission in this preparation. And not only that, understand what the compounds are, like TTX, tetrodotoxin, that blocks sodium channels, TEA, which blocks a subset of potassium channels, and in here they used a different 3-aminopyridine, which blocks a subset of potassium channels as well. And then look at the synaptic responses and how that varies in the shape when they use particular blockers. Okay, so we have to start off with the Nernst equation, which explains how a single ion can give rise to a potential change across a membrane. So you put the concentration outside over inside, gas constant, temperature in Kelvin, Z is the charge of the ion, F is Faraday's constant. So with the concentration gradient of a charged ion, one will develop a membrane potential, or a voltage. This is also referred to as the equilibrium potential for that single ion. All right, and Here are the values. One can simplify this equation at particular temperatures, convert the ln to log, and then for whatever temperature it is you used to use for T, you can then make it a little bit easier for students to work out problems with this. But this Nernst equation tells you the equilibrium, the driving gradient for that ion based at whatever are the potential that can exist due to the ion concentration gradient across the membrane. Now, if we want to go into a little bit more detail, how do you determine, in the squid, they can actually switch the solution out and change the internal concentration of potassium, for example. But in many cells, you can't determine the concentration of ions on the inside of the cell. So what people did is they know the outside, you know your potential across the membrane because you can measure it. You can then calculate with anti-log the internal concentration of an ion. And this is just working out the anti-log to work it out, say, assuming the membrane potential is, that you measure is minus 70 millivolts. Some students have a little difficulty with anti-logs. And then you want to go into the Goldman-Hodgkin-Katz equation, which then allows you to look at multiple ions and the permeability of the ions. And remember, you switch the chloride in over out because you want to get rid of that Z that's down here on charge. And since chloride is negative, you just flip these. Okay, so if we look at the equilibrium potential for sodium, that means if the cell is permeable to sodium, it wants to go to the equilibrium potential for sodium. If the cell is permeable to potassium, it wants to go to the E potassium, the equilibrium for potassium. Most cells are not directly at EK in the resting membrane potential, but there might be a little bit above it due to some sodium leak. So the idea is to go over the action potential, and then you go, depolarize the cell, and you go to threshold, opens up voltage-gated sodium channels. You have the sodium driving towards the E-sodium, but doesn't reach the E-sodium because you open up voltage-gated potassium channels here. And since potassium channels are open, the driving gradient for potassium is to take potassium out of the cell, because it's normally higher in the cell. And then as potassium leaves, the membrane potential comes back down towards E potassium. Remember that the sodium channels inactivate after they open, so it doesn't stay depolarized. The sodium channels are inactivating and voltage-gated potassium channels are opening. This is what causes the membrane potential to then come back down. And the only way to relieve the sodium channel inactivation is to stay at rest for some period of time to remove the inactivation so it can be excited again. So you can talk about, well, what if we blocked some of the potassium channels that would open here? And maybe we wouldn't then counteract the sodium that's coming in so fast. So you might actually raise the amplitude, and you'll definitely widen the amplitude because you're not repolarizing the membrane as fast as if you block potassium channels. Okay, and recall this after hyperpolarization right here. This occurs when E potassium is lower than the resting membrane potential due to potassium flux still occurring going out until those channels close and the pump can reset back to membrane potential. If you get after hyperpolarization like this, this tells you that the E potassium is lower than the resting membrane potential also. Okay, there are online calculators that one can put in parameters and temperature, which is really quite interesting, and see how temperature affects the membrane potential. What's interesting is if you make the membrane colder, since the cell is driven towards E potassium, the E potassium will depolarize and the cell will follow that equilibrium potential for the potassium ion. Because these leak channels, which are a type of potassium channel called K2P, a two-pore potassium channel, that if the temperature decreases, the E potassium becomes less negative and the membrane is permeable to that potassium, so it goes towards a less negative equilibrium potential towards potassium. So it depolarizes in cold. It's kind of interesting. Okay, but then you also can go over where do you get these values for different preparations. Try to find mammalian values for different cells, and it's going to be a little bit hard because it's not well worked out. But it is for particularly invertebrates, particularly invertebrate mussels, which are large, and they've done that, squid axons, and some neurons in invertebrate preparations. So here we're using a crayfish neurons where they estimated the values for sodium potassium chloride in and outside. You vary the saline, so you know what that is. You produce that, but then you have to determine the permeability of these particular ions as well. So one can plug those numbers in there and calculate resting membrane potential, and then see what happens if you change it. Just remember, temperature is in Kelvin, so you have to correct for that. Okay, when one changes external potassium, which is a common laboratory experiment, then one can see that the membrane potential depolarizes along with it. At very low concentrations of potassium, it doesn't follow the Nernst equation precisely, because the permeability of sodium is more prevalent than the permeability of potassium, because potassium is so low right here that it deviates from the Nernst equation, but the Goldman-Hodgkin-Katz equation can be used to estimate then the effect of this low potassium and more prominence of the E sodium and the probability of sodium channels. A little leak of the sodium channels that goes through. Okay. And it's thought that basically, if I go back here, that the leak, some sodium might be able to pass through the leak potassium channel when potassium is really low concentration. So here we go through the diagram again about what maintains the resting membrane potential. Of course, the sodium potassium pump, very high energy demanding process. ATP, probably the most energy demanding process in your body at rest, is producing ATP for ionic balance across membranes. And one of those pumps is the sodium potassium pump. Another pump is the calcium pump, for example. But large permeability of potassium from going from the cell, which is high inside potassium and low outside potassium. So it's leaking out, and sodium, relatively low permeability, is leaking into the cell, but the pump is maintaining that potential. Okay, and you can go over the general shape of the action potential, the rising and the falling phase, as we just mentioned. And you'll see many of these diagrams that are in textbooks, which are sometimes confusing because they don't go into enough detail. But sodium channels open, you hit a threshold where the voltage gates sodium channels, a lot of sodium rushes in, depolarizes it. But instead of just using the word close, we should use the word inactivated. So sodium channels, after they open, they inactivate, they change in their protein conformation, they inactivate, they stay in a closed state, in this inactivated closed state, until the membrane potential comes back down to rest for some period of time. Potassium channels, that just, you see here, potassium channels open. But it depends. There's many different types of potassium channels, but generally then the potassium channels are allowing the cell to then repolarize, go towards the potassium, and then they close, the pump's working, maintains the resting membrane potential. Now you could go through a refractory period, which is important too. This primarily deals with the sodium channels that have been inactivated. After they open, they go through this inactivation state. If you give it some time, that inactivation is removed. If it's too short, this is the absolute refractory period. And as we spend more time with it back to rest, we're removing that inactivation, and we can finally get the full shaped action potential back again. So this is the relative refractory period. This is what's referred to as removal of inactivation. Okay, then the students can draw the shape of an axon, for example, and list the different channels. The general channels of V means they're voltage sensitive. So potassium voltage sensitive, sodium voltage sensitive, calcium voltage sensitive. And here's this very interesting channel, which we should mention. This is the calcium activated potassium channel. So when calcium comes inside the cell, it can activate a potassium channel, and potassium can go out. Should mention about the leak channels. Basically the sodium potassium leak channel, the sodium potassium pump, and then we do have calcium pumps, and then the use of an exchanger, sodium calcium exchanger. So if calcium comes into a cell, which is usually low inside the cell, when calcium comes in, it can be exchanged out for sodium in. Sodium's high outside most cells, and so there's always this driving gradient for sodium to go in. So as soon as calcium comes in, the NCX will work and exchange out. The NCX does not require ATP, it's an exchanger, and it can go both directions. That is, if sodium is too high inside the cell, for example, then it would actually want sodium to go out and calcium to come in. Okay, then it is good to point out the differences of myelinated axons and unmyelinated axons. Basically, the unmyelinated axon with capacitance that builds up along the membrane. So if an electrical signal comes down, it has to neutralize that charge, and it slows down the conduction velocity. As compared to a myelinated sheath, which is insulation around there, we don't have the charge build up, so the electrical signal can jump, saltatory conduction, go very fast. In addition, not shown here though, is that there's different distributions of ion channels at the node and internode regions of the myelinated cell. Okay, and such as we can show figures from this article, for example, where there's different types of sodium channels that are common in the node, some potassium channels. And a number of channels are right underneath the myelin sheath at the junction of the internode to the node, and they've divided this up into like paranode, juxtaparanode, and internode region. And we can see also then pumps and sodium calcium exchangers that are working here. So it gets a little more complicated, and then to try to think about synaptic transmission and what would happen with maybe a 4AP sensitive voltage gated potassium channel that might be blocked, for example. So an action potential comes down, sodium in, potassium out. It would open up voltage gated calcium channels in the presynaptic nerve terminal, which then causes vesicles to fuse and release the neurotransmitter, right? Remember to go back to the Goldman-Hushkin-Katz equation about permeabilities of ions, because this is really important in developing that membrane potential. Okay, now coming back to the action potential shape and stating that there's many different types of potassium channels. This K2P channel is what's also referred to as the potassium leak channel. It is not only a temperature sensitive channel, but it's actually mechanosensory, and it is thought to be the one that is open at this resting state that drives the membrane potential towards the E potassium. So during rest, this is open and it's driving the potential towards the E potassium. There are many different types of voltage-gated potassium channels that open at different thresholds. And then here you see the calcium-activated potassium channel. And if that stays open for a long period of time, that can actually cause the cell to be hyperpolarized for a longer period of time and actually decrease the activity, right? So as we see here, increased potassium channel activity, it could cause it to stay hyperpolarized for a longer period of time. But if you don't have this aftershoot, you could actually bring the action potential down faster by having more potassium, and then you could excite the cell quicker because you've removed the inactivation and it's back down to rest faster. The inactivation of the sodium channel, I'm saying. So this figure can be a little confusing. It depends on the potassium channel that one's talking about. So in this case, increased calcium-activated potassium channel that may keep it hyperpolarized for a longer period of time, it can actually slow down the electrical excitability of a cell. If you don't have that channel, and you have more of these voltage-gated potassium channels that bring the potential back faster, it could actually enhance the electrical activity or excitability of the cell. Okay, and now if we look at the individual types of channels with a given stimulus, so you give a voltage stimulus to the membrane, and you see how these channels, their kinetics. Look at some open and stay open. Some open, and actually this Kv4 channel inactivates, kind of like the voltage-gated sodium channel. This one's a slow opening, even though its membrane's opened and it's past its threshold of opening, but it's slow for changing its conformation and getting potassium out. And here's a Kv3 and a Kv2, and depending on the voltage that you cross the membrane, you might get a little bit of current or more current. So now you can divide up that action potential into the different types of potassium channels that are open at different times in the shape of the action potential. And if you block some of them, you're going to change the shape of this. Or if you have more of a particular type of potassium channel compared to the others, you might change the shape as well. And then if we start to think about the different types of neurons, like a C fiber, a pain neuron, unmyelinated, you see no myelin here, and you see myelin here, that could change the conduction velocity. Look at all the different types of potassium channels in the nerve terminals and the axons and the cell body. and in these terminals that are going to release transmitter. And then we have even astrocytes and microglia with different types of potassium channels. This is important for later on what we're going to talk about. Okay? And then you see a nice diagram down here. It's describing these different types of potassium channels along the axon, and they found this with antibody staining to the different types of potassium channels, and you can now see the distribution is much more complicated, and even in the Schwann cell itself, the type of potassium channels that are present there. So now it's not just a simple one type of potassium channel that we deal with. You can look at the different kind of blockers in different cells. The point here is that it depends on the cell and the type of channels presented that are expressed. So in this case, TEA blocks a more delayed potassium channel, and if you have control and you give that, it doesn't come back down so fast. But likewise, 4AP blocks more of the fast activating potassium channel, but if you give that, it actually doesn't come back down as fast either and broadens the action potential. But other cells could respond differently to the 4AP and TEA. Some cells are not that sensitive to either the TEA or the 4AP, so there's not much change in the shape. And in this case, we see that the 4AP, giving the 4AP actually decreased the firing frequency, and giving TEA decreased the firing frequency. In some cases, in some neurons, having these compounds could actually enhance the amplitude, because now it's not counteracting as much. The potassium going out isn't counteracting the sodium going in as much, so you get a larger action potential. And then it's concentration dependent. So here, just look at the shape of this action potential. 30 micromolar, relatively small, it does widen the shape of this action potential. At 2.5 millimolar, much higher concentration, the action potential becomes much wider. So it's a concentration dependent process as well. And we see here TEA at 25 millimolar, it became quite wide, kind of like this high concentration over here, the 2.5 millimolar. It usually takes a higher concentration of TEA to have an effect compared to 4AP. And this is just an example of maybe blocking the calcium activated potassium channel by using cobalt. Okay, so now we go back to, if you had an action potential and you blocked one of the voltage-gated potassium channels with 4AP, what would it do? Widen the shape of the action potential, cause more voltage-gated calcium channels to maybe open, or keep them open for a longer period of time because it's above the threshold for the voltage-gated calcium channel. So more calcium will come in. The more calcium that comes in, the more vesicles that will fuse, and more transmitter that will be released. So that's the idea here. By changing the shape of the action potential, you could then change the amount of transmitter that would be released. So let's listen to some of those case studies.
The doctor may be thinking that this is some sort of demyelinating disorder, but you're trying to figure out if it's more peripheral involvement versus central nervous system involvement. There could be different things that cause nerve demyelination. So you have the different neuropathies, such as Guillain-Barré syndrome, Charcot-Marie-Tooth disease, or is this something more related to the brain and spinal cord? With the demyelinating disorders, could be the optic neuritis is causing the double vision. Could it be, Lyme disease? So there's a lot of different things that the doctor has to do in order to rule in or rule out different diagnoses. So the doctor will do special tests in order to rule in or rule out differential diagnoses. In order to diagnose someone with MS, it can take months to years due to the type of MS that the person may have. There are blood tests that can be done to look at other diseases that may be mimicking similar symptoms. You can look at antibodies via lumbar puncture, imaging, brain imaging using MRI to look at lesions that are in particular areas of the brain that may explain the difficulties with walking. You can also look at evoked potentials, either with a visual stimuli or electrical stimuli, to look at the response of the stimuli and then the nerves, to look at how quickly the information travels down the nerves, that can also lead to the diagnosis of MS. So classmate Jane tells you that she is diagnosed with MS. There are three main types of MS. There's relapsing remitting, is where you have your attack, and then there's a remission period where symptoms disappear completely or partially disappear. There is secondary progressive, which is where you progress steadily with active and non-active states. There's primary progressive, which symptoms worsen over time without early relapse or remission. The doctor will do that.
So then I would go over the general idea of multiple sclerosis. Most of the students will have thought about just the demyelination process, but there's much more to it, such as the autoimmune response, and factors that can influence how the nerve functions, such as with breakdown of the blood-brain barrier, and then microglia and immune cells that can come in and actually place havoc on the neuronal function. So they might want to go through demyelinating the sources of peripheral nervous system, which is different than the central nervous system, and MS is primarily the central nervous system. So we should talk about MS, and we see there's a number of different diseases that can cause this. And MS is primarily then central, what we're talking about. Okay, and then it might be very interesting for the students to go through the age and the disease, like we talked about the epidemiology of it and the types of people affected, and the pathological changes that occur as we progress through the disease. So this is through the progression of the disease. Inflammation, blood-brain barrier, and then you get to the more severe effects and the pathological changes. And then maybe a separate discussion on the disease mechanisms, of what the mechanism is behind these changes, these pathological changes. And a lot has to do with the immune response or activity that might have to do with mitochondrial dysfunction and ROS, reactive oxygen species, that can cause damaging effects to the neurons. And at the more severe cases, then, actually there might be iron accumulation as well from the oligodendrocytes being disrupted. So there's a lot of information that students can think about and how the mechanism of those pathological changes come about. So in some cases, this is really talked about the four main types of MS lesions that one can see. Blood-brain barrier breakdown, chronic inactive lesions, and the remyelinating plaques. We'll go over that. The four main types clinically seen with MS is listed here. So the students might classify the different types of MS and give some descriptions to these, for example, and they'll find some references that they can use for this as well. Okay, and then they might see some images that they can pop up from the web, such as it shows these different plaques, for example, or the places that are just forming. They can look at the inflammation that would occur in MS, which is important, for example, and see those responses. There's macrophages that come in, damage, and these places with other macrophages and degradation that is occurring in the nervous system. They might look at some electron micrographs and see more of these holes that are forming here. So that could be interesting to them. They might see some of these very dark stained places, such as these brown and really dark black staining, where their microglia and T lymphocytes are coming. So this is key now, because now we're talking about the immune system, these T lymphocytes that are here, and these microglia that are invading the neuronal regions. Okay? And then they might find out more about multiple sclerosis versus other autoimmune diseases and what causes them, neurotoxins, virus, autoimmune, for example. Some really nice descriptions in the literature help them to understand visually what's going on, and then start to get into some of the details. And there's different views on MS and the progression of MS. Some people feel that it might be an energy-dependent process where there's a lack of energy. The mitochondria can't keep making ATP, for example, and then the pump can't work, so sodium will build up inside the cell. If sodium builds up inside the cell, what did we remember about the sodium-calcium exchanger? If sodium builds up inside the cell, sodium can go out, but then calcium will come into the cell, so it reverses the sodium-calcium exchanger, and that can lead to more damage, because if calcium comes in, that can lead to apoptosis. And then the oligodendrocytes can be damaged as well, and release factors, as well as potentially building up with calcium. So this can cause problems, and if the microglia, for example, come in and release glutamate or other actions, that can cause damage to the cells, overexcitation. So there's differential diagnosis of MS, and it follows this McDonald criteria. It was altered or revised in 2017. So here's a nice reference for this that students can actually find. This imaging element, gadolinium, is used because it normally won't pass across the blood-brain barrier, but in MS, when the blood-brain barrier is damaged, then they'll see this go across the blood-brain barrier, and they know that there's a disruption in the blood-brain barrier, and then probably microglia and T lymphocytes also going into the central nervous system.
Classmate Jane tells you that she's prescribed this AMPRA, which is dalfampridine. It's an extended release form of 4-AP. It's FDA approved in order to improve walking speed, which also helps decrease the risk of falls. It is not a disease-modifying drug, but it helps with the symptoms of MS. I believe the clinical trials showed that some patients respond really well to this drug. About 42.9% showed improvement of symptoms, mainly walking speed, but some patients did not respond with any changes to this drug. It's not well known the exact mechanisms of this drug, but we know a little bit about how 4-AP does work. 4-AP is fat soluble, so it's able to pass the blood-brain barrier with the thoughts of being able to improve conduction of the action potentials in demyelinating nerve fibers, so increasing neurotransmitter release in the synapse of the neuromuscular junction, with thoughts of prolonging and broadening the action potential. But in the following slides, we'll talk a little bit more about how 4-AP is actually working.
So the idea again is that the action potential will become wider, and that would allow more voltage-gated calcium channels to open and stay open for a longer period of time, which then triggers more vesicular fusion and more transmitter release. And if you have more transmitter release, then there might be more activity of the motor neurons, for example. But you can imagine this is working also on sensory neurons, interneurons, and all other neurons in the brain as well. Okay, but the idea is it might even be activating a calcium-activated potassium channel. The more potassium goes out, that could widen this, and it might even hyperpolarize the cell. It could even cause the firing frequency to decrease, right? So it depends on what type of channels are present in the nerve terminal, and of course, in the type of nerve terminal we're talking about. Okay, so remember, there's many different types of channels here, but we have to think about in MS, this myelination goes away, and now these channels vary in their exposure to the compounds. But not only when myelination goes away, these channels change in their distribution profile and even expression of the type of channels. So it doesn't stay in the same arrangement after demyelination. So how can the complications of MS may complicate or explain some of the variations seen with treatments of 4-AP? Well, we talked about already the energy-dependent process. When it's deficient, for example, well, maybe some people are more on the spectrum of this particular model, and maybe then this is actually a problem by having too much calcium inside the cell versus others that aren't in this energy deficient state, if this is one of the mechanisms. Maybe in some cases more of the oligodendrocytes are damaged, and even more iron spilling out, which we'll see could cause more problems, and others not as prolonged in the disease state. Because remember, there's lots of progression with this disease state over time, and maybe 4-AP works better in particular states of this due to the mechanisms underlying the cause. Okay, another idea is that this damaged myelin can actually cause peroxides to be released, and then if peroxides released from this microglia, for example, that come in due to this inflammation that's here, due to the blood-brain barrier breaking down, that can actually trigger these oligodendrocytes to be then responsive or activated and then release iron. And if iron is released, iron can be toxic to cells and be even toxic back to the oligodendrocytes from an external aspect. So now this could actually be a problem. And then this iron can actually, it's now known that iron can block ion channels, for example, like sodium channels, and can have an effect at the neuromuscular junction, or I should say at the synaptic site, in the central nervous system. So for chemical transmission, it may block even the voltage-gated calcium channels, so you have less transmitter release. So that could give rise to a different state of MS. So how do they figure out all this distribution of ion channels and how they move? They use antibodies to stain like the sodium channels here, potassium channels, you can see them in light blue right there, and then look at the distribution with demyelination and how that changes. And so it's pretty well known that there's variations in these channels with demyelination and how they spread out with demyelination. We can see that people have actually measured the length of the staining in demyelinated states. For example, here's the Kv7 potassium channel controls, and in demyelination they have a much longer staining profile of actually seeing the distribution of that particular channel. So now the drugs might work differently because there's different distribution of these ion channels with demyelination than in myelination, so that can be varied. And then you think about what we just talked about with the inflammation and causing energy insufficiency because of the actions on the mitochondria, but also if we're having hyperactivity of cells, that can form more ROS, reactive oxygen species, and those can damage the cells as well. But if calcium's building up in here by higher calcium, we might get apoptosis and axonal degradation. Okay, so they can do more research in the literature and understand more about the cases of how the MS causes problems in the distribution of ion channels in this demyelinated state, and then maybe degradation of axonal degeneration and breakdown of the axon, for example. And this is just a figure legend for the figure that was shown before in the details. Some of the ideas that are mentioned for these drugs, they just show that 4-AP binds to this potassium channel and causes then the action potential to change its shape and allow better conduction. But as we know, that might not be as simple as what is shown here. So some people have actually written papers about the actions of blocking the potassium channel with 4-AP, and it actually pretty clearly demonstrated that there's no clear reason that 4-AP would be expected to add in to a wider shape action potential in the nerve terminal due to get that response. You have to go to very high concentrations of 4-AP to really get the action potential wide enough to have an effect on vesicular fusion events. This kind of concentration would be toxic to the humans to take this, so it doesn't seem that that is really the mechanism of action. Some at lower ranges might be due to the excitability of the cell. So it's still unknown exactly the mechanism of action there. But remember, when we're talking about these actions, 4-AP might not just block, one type of potassium channel. There's a variety of different types, and they've actually found out that there's different binding in amyelinated or non-myelinated neurons than demyelinated neurons versus well-myelinated CNS regions. So we might be getting a change in the binding over time of 4-aminopyridine. And maybe these cells really, this leakage of potassium that occurs with MS, is that could actually influence how the cell might be repolarized as sodium channels are inactivated with depolarization. maybe not getting full recovery. That could be part of the issue, and how 4AP blocks to these particular channels in these different states. It's really important. So here's a reference to a lot of this work with some imaging techniques. And then cover some of the latest literature in explaining how 4AP works. You might find some reviews, like in here, for example, 2007, that talks about how 4AP works and changes the nerve impulse, for example. Then you might even dive into literature about multiple sclerosis with the activated T cells. When activated T cells occur, then you can have an immune response that would be changing the scenery quite a bit. The thing that's really interesting is that these T cells have a potassium channel, a voltage-gated potassium channel, that is blocked by 4AP. And if we can block that potassium channel, then we might block the response of the T cells into the brain. So maybe it's really 4AP is doing a little bit of multiple things. Could be activating on the T cells when they're present in the brain. Maybe that's more of a side of action and actually helping, and why some patients respond better than others. Not only that, is that these cells, like the lymphocytes that are in there, they can release a factor called a protease, a destructive protease, gramazine B, and if these cells have the Kv1.3, 4AP can block that particular potassium channel and actually then maybe decrease the destructive proteases that are being released. So maybe 4AP is having other effects that then allows the patients to have better outcomes than really increasing the width of the action potential at the nerve terminal and causing more vesicular release that way, but by decreasing the inflammation response by these T cells and lymphocytes that come into the cell. So this is interesting because it's known that 4AP can block these particular types of channels, and that those are found on these immune response cells. And you can look at these references. The students might find these references as well. So I think it's a good time to have a class discussion after they go through this content and have time for them to understand some of these different details. And then what do they think the next steps might be for research in this area? Are different compounds that are related to 4AP that might work better than 4AP. And so that would be interesting to see. They can also watch this nice little video here that's online. I'll speed it up a little bit.
This was demonstrated by an increase in walking speed.
In healthy individuals, neurotransmission occurs through propagation of action potentials or electrical impulses along myelin-coated nerves. The myelin sheath that coats the nerve is formed by an oligodendrocyte cell that wraps tightly in multiple layers around the axon. The high resistance of the myelin sheath prevents the electrical impulse from leaving the axon. This, coupled with the sheath's weak ability to store an electrical charge, allows for rapid conduction with little energy used. This makes the myelin sheath a critical component for axonal conductance of electrical impulses. A hallmark of MS is the loss of this protective sheath, a process called demyelination. Demyelination causes an uncontrolled loss or leakage of intracellular potassium from the axon. This results in a change in action potential. When the electrical impulse arrives at a demyelinated segment, it becomes diminished. This results in either slowing of conduction velocity or inability to sustain repetitive impulse discharges or conduction failure. The mechanism by which dalfampridine, the active compound of Ampyra, exerts its therapeutic effect has not been fully elucidated. Dalfampridine is a small, lipid-soluble molecule that crosses the axon cell membrane. Once in the axon, dalfampridine blocks the open potassium channels, greatly reducing the uncontrolled loss of potassium. As a result, there is an increase of the action potential and improved neuronal conduction.
Ampyra was effective across all 4 major types of MS disease course.
And you can keep going through that video. There's more content to that video. The students can find that and go through there. There's actually even therapies about decreasing these factors that are growth inhibitory factors like NOGO-A. And if they block the inhibitory factors, then they can get the neurons to sprout and maybe grow better. This is an idea with these injured neurons and some therapies that are used with MS. So remember, there are therapies that could maybe address the energy insufficiency that goes on with maybe ATP or mitochondrial damage. You can think about that as other therapies are being discussed or you find. So we appreciate in this module comments that were provided by Dr. Sandra Blumick from Germany. She actually works at a pharmaceutical company and actually studies the effects of MS. All right, and so the next part of this series is actually an experimental protocol introduced by Rachel, and she will explain this protocol that we have developed for the crab leg, a nerve in the crab leg, and one can then put the compounds on and actually see how that alters synaptic transmission, or at least not synaptic transmission, I should say, conduction of electrical signals, and actually the initiation of those in sensory neurons.